Welcome to Evergreen Family Medicine. Today we are with Dr. Shelley Brittain, and we're talking about transition of care, which is a very important appointment that we at Evergreen collectively want patients to keep. Transition of care is so important. Thank you for your time today.
Thank you. Thank you for having me.
So what is a way to introduce transition of care to people?
You know, I think a lot of people don't really think about this as something that is important. Transition of care for us has been a process that we've been involved in really emphasizing over the last couple of years. Basically, this describes the process of transitioning from care in the hospital, where a person has been there for an acute illness of some sort, to the home setting. And there are a lot of pieces of that. We know that if we are able to contact patients and to interact with them within the first week that they're out of the hospital, that they're home, that really reduces the likelihood that they'll have to return to the hospital.
And I think everybody wants that.
Everybody wants that. Nobody wants to be in the Very few people want to be in the hospital. So we want to make sure that we do everything that we can to help folks understand that process. It is a multi-stage process. So at the time of discharge, our providers in the hospital typically will ask patients to anticipate a phone call from one of our transition of care coordinators. That coordinator will contact the patient within 2 business days after discharge with several goals in mind. First goal is to make sure that they are clear on the medications that they were discharged with, that they have the medications that were recommended at discharge, that they understand how to use those medications, and it may not be the patient, it may be a caregiver that they talk to. And then, as importantly as all of that, is to make sure that they have an appointment with a provider in primary care within the first week that they're home. Most of the time that is with the person's primary care provider, but if scheduling will not allow with that, we feel it is so important they get in within that first week that if we need to schedule them with another provider in primary care, we do that. And it sets the stage for their follow-up with their PCP at a later time.
So the big message here is to expect that phone call.
Yes.
And to keep that appointment because of how important it is for continued health after you leave the hospital, so you are not coming back to the hospital.
Absolutely. Because oftentimes what happens in the hospital, there are changes that are made in medications that are ongoing. So one of the things we've noticed in the past is that patients would go back home and they would say, well, I'm back home now, I should go back to what I'm doing. At the time of discharge from the hospital, we very carefully go through the list of medicines that the person has had at home as we understand it. We very carefully adjust the doses of those medications in the hospital, and the intention at discharge is for folks to go forward with that. And that can be pretty confusing because it may be the same name of the medication, but it may be a different dose. Or it may be a similar medication that will replace one other. We've seen all kinds of problems after discharge where they've gone back to the old doses. They thought, well, I haven't seen my doctor yet. I need to ask them about this medication. We've seen duplicates in 2 medicines that basically do the same thing, and all of those things increase the likelihood that that person is going to end up back in the hospital again in a short period of time. So that's huge. I mean, that is a huge thing for us to complete.
It sounds like this is so important on so many levels. What else would you like to say about transition of care?
Yeah. The other thing that this visit and this process allows is for us to make sure that, for instance, if home health has been recommended, that has been initiated, that they've had some contact from home health, that if appointments with consultants are needed, that they understand who those consultants are to be, and that if the orders have not been placed for that referral, that we can place those referral orders as well. And this includes not only patients that have been hospitalized here in Roseburg, but we do this for patients who are hospitalized at outside facilities as well. Because many of the folks are not going to be, for instance, if they've been to Portland, they're not going to be traveling back to Portland necessarily for that visit with the consultant. They may have a telehealth visit. We really want to see these folks and put our hands on them, have a chance to listen to heart and lungs, and truly make sure that everybody's on the same page.
Lots of layers, lots of reasons for transition of care, but again, the biggest part is to take that call, keep that appointment, and make sure that you benefit as much as possible from the care you receive here at Evergreen. Thank you, Dr. Brittain.
Thank you, Brian.
Dr. Shelley Brittain, Transition of Care. You can learn more about what's happening at Evergreen Family Medicine at evergreenfamilymedicine.com, and follow us on our social media channels on YouTube, Instagram, Facebook, and Twitter.